Providing foot care on one foot. Foot care is done to promote foot hygiene and wound healing and is very important in the diabetic patient. If not performed correctly, it can lead to skin breakdown, sores, infection, and possible amputation of the limb. You will have 5 to 6 minutes to complete this skill. You will need a large basin, soap, lotion, a large towel, 2 washcloths, an incontinence pad, and gloves.
Good morning, Ms. Eunice. I'm Nicole. I'll be your caregiver today. I'm just going to check your wristband. Just going to do some foot care. Soak your feet in some nice warm water and clean them up a bit. Is that okay? Okay, sounds good. Let me go ahead and put your bed up to waist level. Did a lot of bending in this skill, so you want to make sure you bring the bed up to you so you don't strain your back. So this skill actually requires you to wash the feet. Well, you soak the foot first, and then we wash it. And then we dry it off really good, and then we put a nice lotion on there. Moisturize the skin. Okay, now we're going to go ahead and raise the head of your bed up about 30 to 45 degrees. 2 reasons: to help the patient be able to engage with you, and also to help to make the bucket of water a little more steady so it doesn't flip in the bed. Okay, so I'm going to go ahead and go to the other side of the bed and close the privacy curtain. Okay, Ms. Judith, I'm going to go ahead and grab my supplies and I'll be right back. Wash your hands, simulate it. Grab my supplies. Then bring the table down to where we're going to actually be working. We're just going to be at the foot of the bed. Then we're going to do what we call the pre-prep. So you just want to expose the one foot. So we're going to take an incontinence pad and fold it inside out so that the absorbent side shows. And this, you're going to put this up under the leg the long way. And when you're at state, if they don't have an incontinence pad, just go ahead and use 2 towels. This protects the bed in case you spill the water. So now we're going to take a large towel and just fold it in half once. Have the open flaps towards the foot of the bed. That also goes under the patient's leg. So now we're going to go ahead and cover the foot back up while we go and get the water. You never want to leave your patient exposed when you leave the bedside. So I'm going to take everything out. Put it on the table. I'm going to go and wash my hands and get the water. Let's go over to the sink. We're going to go ahead and set the bucket down. Turn the water on. Simulate washing hands for state. You get the water a bit warm, probably about, you want to make it no more than 105 degrees. You want to fill the bucket up about halfway, just enough to cover the foot as we soak it before we wash. You can always check the water under the faucet just to make sure. Okay, that looks pretty good. Now go ahead and get another paper towel and dry your hand off. Clean paper towel, turn the faucet off. Okay, we're going to go ahead and walk back over to the bed and soak the foot for 10 minutes. And we're actually going to scoot the table, the bed over a little bit. We're going to put the table at the foot of the bed. This is where you're going to be working. So I've tested the water. The water feels really good to me. I'm going to let Miss Eunice test the water. Be careful not to spill your water. And since this is a mannequin, you have to kind of bring the water to her. So, okay, Miss Eunice fills the water and she says that is great. So now once the mannequin, once your patient, your client says the water is great, you can go ahead and put your gloves on. Don't put your gloves on before, because if the resident does not like the water, then you're going to have to get new water. Okay, so I'm going to go ahead and uncover. Make sure the whole bed stays covered. Okay, Miss Eunice, I'm just going to bend your knee up. I'm going to put the bucket of water under the foot. And we let the patient know that if we were actually doing this, we'd be soaking their foot for 10 minutes. Make sure the foot is fully immersed. Make sure the bucket is laying flat. and make sure not to expose your patient too much. Okay, so since we're simulating, I'm actually going to soak their foot for 10 minutes. We just say 10 minutes. So you want to bring your table over, get everything set up. And then you're going to get your soap and your washcloth set up. So now we're going to take our wrist and go under the leg. You want to make sure your fingers stay free. Scoop the bucket down. Make sure your fingers stay free so it can help you flip this washcloth. You're going to be flipping this washcloth. So you can use a different section every time you wash a different area of the foot. So we're going to put a little soap on here. No soap in the bucket. You always want to lather away from the bucket. So we're going to wash the top of the foot, the side of the foot, other side, the bottom, and between the toes. Washing towards the toes. So you wash the top. You flip the washcloth. Get a new edge. Wash the side. Flip the washcloth. Other side. Flip it. We get the bottom. Then we make a mitt. We have 5 different sections. We're going to wash in between the toes. Really good. So make sure you get in between there. Okay, we wash. Put it in the dirty clothes. And now we're going to rinse. Doing the same exact thing. Make sure you leave your fingers free. Okay, you're going to wash on top. Mannequin's foot can be a little bit slippery. Remember, it's not a real person, so just be careful if you're practicing. Inside. We flip it again. Other side. Last flap gets the bottom of the foot. We make a mitt. Brand new section. Let me get between the toes again. Make sure you get all that soap out. Okay, put that in the dirty laundry. Now we go ahead and sit the foot down. We can put the bucket on the table, get that out of our way. Let's scoot the table back a little bit so you can see. Okay, we're going to take the top flap of the towel. I'm going to pat the foot dry really good, especially between the toes. You never want to leave moisture between the toes. It can cause skin breakdown, especially with people who have poor circulation or diabetics. Get it nice and dry. So lift the foot up. That part of the towel is wet, so just roll it back, get it out of your way. Now we do the lotion. Best part of the skill for the patient. Get a little lotion in your hand, rub it in, get it nice and warm. Now we're going to just gently pat it all over the patient's foot. Nice moisture everywhere except between the toes. Never rub lotion between the toes because again, we don't want moisture in between there. Don't want to cause skin breakdown. So once we're done, go ahead and pat off the excess. Don't need to have too much there. Okay, we're going to lift the resident's foot up. We're going to take the incontinent pad as well as the towel and just roll that away from you towards the foot of the bed. We're going to also put that into the dirty laundry. Okay, we're going to cover your Miss Eunice's foot back up. I'm going to go ahead and go dump the water. Scoot your table over out of your way. Take your soap, take your water, and take your bucket. Be careful not to spill your water. Okay, now that we're all done, we're going to go ahead and dump the water. Let's walk over to the sink. Let's sit everything down so we don't spill anything. And go ahead and dump the water into the sink. Be very careful not to spill a splash. Okay, let's grab a paper towel. Turn the water on so we can rinse. We want to rinse the bucket twice. We rinse. Really good there. And dump. And you can dump into the sink or the toilet, whichever you prefer, whichever is closer, more convenient. And we pat dry the basin. You want to always pat dry the middle of the inside first. And then the outside. Then we go ahead and put these in the designated area. Those back, we can do the next time. Okay, now we remove the gloves the right way. Hold up, go under, and over, put in the trash. And we simulate washing hands for safe. Get a clean paper towel. Turn the water off. Do not touch the dirty part of the paper towel and go ahead and throw that away. And we're going to go back over and finish up with our patient. Take the table back up against the wall since we're no longer using it. And always put everything back the way your patient had it. So put it back in the lowest level. The patient's not using it right now. And just fix the bed back. Just get your patient nice and neat. I like to do hospital corners. It's not a requirement, but it does make everything look really good. Okay, Miss Eunice, we're gonna go ahead and put your bed back in the lowest position. For safety purposes, how's your feet? Feel nice and clean and moisturized? Okay, I'm gonna just put the head of your bed down. Would you like the head of your bed all the way down or slightly up? Okay, she says she wants it up just a little bit. Is that good? Okay. I'm gonna give you your call light. I'm just gonna go back to the other side of your bed and close it and open your curtain. Okay, Miss Eunice, we're all finished for the day. Thank you for letting me take care of you. Anything I can do for you before I go? Okay, great. I'm gonna wash my hands, simulate for state, document the procedure, and the skill is complete.